All right, good evening, students. Welcome to lecture on chapter number 2. This is part 2, so we're going to finish out the rest of the lecture this evening. And in the first part of it, we were talking a lot about examination protocols, how to talk to clients, discharges, inventory management. So for the second portion, end to end out, we're going to get into a little bit more with client relations, talking about computer management. We'll get into looking at the animal-human bond, as well as euthanasia protocols, and with our plethora of different, I don't want to say spreadsheets, goodness, like forms and consent forms is what I'm looking for, consent forms that they're going to be signing off on. So I'll actually show you guys, I have a lot of different ones at the end I'm going to show you just so you guys have an idea of what they look like. So getting into our lecture for today, looking at computer and software management, we primarily will use a digital system in the hospital, which means that all of our records are on the computers. So we'll even use like iPads instead of clipboards and papers. We can use iPads or tablets, and then just have computers at all of the stations throughout the hospital. So there can be anywhere between like 5 and 20 computers in one hospital, depending on how big it is, how many doctors there are, and that's so that anybody can access the medical records at any time. Now, these big software systems that we use, there is training that we do on them. So don't worry, you guys, you're not going to be expected to know how to use these softwares. You will go through extensive training on how to use them. And once you learn one, it's fairly easy to learn another. They all operate in the same type of a way. And we mainly use the software systems for keeping track of our clients and our patients, as well as their information, when we invoice them, what they came in for, all of those records. It's pretty much all implemented on our computer systems. We also will back up any data for these computer and software management systems. We back them up in the clinic as well as on an off-site. So even like via a thumb drive or a flash drive. And this is just so that in case there's a theft or fire, we still have a backup of those records. It's not like they're completely gone. And we do have to update our systems. Every software will go through certain updates and improvements. You might even decide to go with a different software for different perks or reasons for like that. So, and again, all of the systems, they're very, very similar to one another. Okay, as we touched on in our last lecture, looking at client relations, that first impression is so important. The receptionists, they're the face of the hospital. They're the first people that the clients see when they walk in, and the last people they see when they leave, when they get invoiced out. So communication is really important for that role. And vet assistants, we can help with receptionist roles, and we can also be a part of that, first impression as well. We're the ones that check them in and get all the history taken. So we do have to be aware, and something that we'll just deal with, it's just a part of life, is dealing with people that are unfortunately not happy. So the goal is to, make sure that everyone is as pleased as possible, happy, and they feel satisfied with the visit and the care that we've given them. Unfortunately, not everybody is going to feel that way. So we do have to respond differently to angry or hostile clients. And the biggest thing that we can do is identify that body language, identify when they're starting to get upset, and then isolate them. So if we have a client that's having not a good day and they are starting to make a scene, we want to de-escalate the situation as quickly as possible. So we would actually isolate them. We take them into a different exam room, even outside of the clinic, pretty much anywhere that's not in the main lobby. When you're in a main lobby, pretty much anyone and everyone can hear you and spreads through the walls. So we want to try to get them into a more private space to talk about the issue. Grab a manager, grab a doctor, whatever you need to do. But try to detect, looking at, are they folding their arms? Are they becoming really hostile in their body language? Are they keeping really intense eye contact or losing that with you? So try to pick up on these cues before they really start to kind of act out per se. If you've ever worked in customer service, you know what I'm talking about. Some people really just let their emotions run rampant. And it's understandable in the vet field. I try to be as understanding as possible, because if they're dealing with a sick pet, stuff is going on in their lives, financial issues, it's acceptable that people can start to, feel on end. And might take it out on us. So just be aware of that. If we have people like that, isolate them, try to grab more people to help you solve the issue. At the end of the day, you're a vet assistant, you're not a manager. Managers should be the ones dealing with upset clients and everybody like that. But try to get them out of everyone's ear view and listening range. Touching on those phone techniques, really important that we try to effectively handle any hostile clients that are over the phone as well. People can call and be upset for a numerous amount of reasons. I want to say the reason people are most upset nowadays is they can't get in right away for an appointment because of the pandemic and the uprise in pet ownership. I don't know if you guys have experienced this with your own pets, but sometimes it can be a wait of 2 or 3 weeks before you can get him for like a regular appointment, which can be that's a really long time. So a lot of that, the frustration of not being able to schedule earlier, or that same day if they think an emergency is going on, that can definitely be a reason to have that hostility with clients on the phone. So again, if that happens, what we want to do is we want to try to turn this into a positive experience, whether that's, putting them on hold and trying to see if we can squeeze them in somewhere, transferring it to an upper management to help you schedule that person or to figure out what we can do. A telehealth appointment, they're starting to do those now for pets, or even just referring them to another clinic. We are going to try to do what we can to salvage that situation. The biggest thing is don't lose your cool. Clients, they're going to lose their cool and they're going to say things and be rude, and people are going to be people. And the most important thing, especially when you're handling phones, is to try to be always respectful and courteous, regardless of what somebody is doing to you. Again, you don't know what they're going through. You don't know what outside things are happening in their life, and now their animal is sick. They might be having money issues, whatever. It can come off in other situations in people's lives. So try to take it with a grain of salt, try to make it as positive as you can, and try to make them feel comfortable, listen to their issues, see if we can formulate a solution. If we can't, transfer it to an upper management and they can deal with it further. You're not going to always solve every issue that you come across. Some people are just going to be angry from the get-go and nothing is going to suffice. So just remember that. And people in the world will be nasty, but our job here is to, treat their patients, treat their animals, and try to do the best that we can by them. So practice the best medicine that we can. There will be multiple phone lines in the hospital. There can be up to 6 different lines, if not more, depending on how big the hospital is. So it's really important, if you're ever working phone lines, working with reception, that you can effectively multitask. It can become really overwhelming. If you've never dealt with a situation like that where multiple phone lines are going off, you have to put multiples on hold and keep track of who is who and where is where. It's something that can be, again, overwhelming at first. When you get into the field, the more you do it, the more comfortable you're going to be. And again, you'll learn with time. It's not something that you're just going to hop right into and get the hang of. Biggest thing is we need to deal with the clients that are right in front of us. So if we have a line that's going out the door at the front desk, we're going to have to put lines on hold or have a designated receptionist answering these calls, because the people in front of us are really our main priority. We will be placing people on hold, and we can have many different lines that are on hold. Different people in the hospital can pick up the phones and help us with that triage of patients, which again ties into vet assistants and vet techs. Just because they're working in the back and with animals doesn't mean that they're not going to be answering phones and helping reception when needed. Really important, if we do place somebody on hold, we don't want to leave them on hold for longer than a minute. I'd say 3 minutes is probably a max. 1 minute would be like really ideal. It's not something that's going to happen all the time. If they're going to be on hold for longer than like 3 minutes, I would pick back up the call. It usually will ring back to you. When you put it on hold, within, depending on what the setting is on the phone, it'll ring back after like a minute, 2 minutes, 3 minutes, to where it just like lightly rings back to remind the receptionist, hey, there's a caller still on hold on this line. You need to pick it up. So we can pick it up and then say, I apologize for the extended wait. I'm going to have to place you on hold for another few minutes. Thank you so much for your patience. I will be with you shortly, and place them on another hold. So this is something that we'll do, especially when we're super busy. It happens. And if it's really important to them, they will stay on hold until they can get a hold of somebody. If it's an emergency, that's really the only difference. When we answer the phone and it's an emergency, something's actively going on, we will then give that person our full attention. And it is what it is. If it's a true emergency, you know, a blow, a hit by car, a seizure, anything in that type of a matter, or if it's something that's not necessarily an emergency, but an owner thinks is an emergency, we want to try to de-escalate the situation and still try to get them ultimately on that hold until we have the time to give them our undivided attention. Now, when you are answering the phone, again, there is kind of like a script that you'll follow. When we do answer phone calls, we'll want to introduce ourselves, introduce the hospital. I usually like to even just like introduce the day. Like I like to say good morning or good evening, good afternoon. I'll then introduce myself and the hospital, you know, good morning, Paradise Cat Care. This is Shayna. How can I help you? Or, you know, thank you for calling Paradise Cat Care. This is on an emergency. May I please place you on a brief hold? So you're going to be following that script really every single time you answer the phone. I used to have a sticky note right in front of me when I worked reception when I was first starting, and I literally had it written out exactly what I was going to say so that when I answered the phone, I read off of my script so that I wouldn't get it wrong. It was something that I was really nervous about getting wrong. So just know you're going to follow that every single time. So introducing, you know, saying good morning, good afternoon, good evening, introducing your hospital, yourself, and then asking on how you can assist them further. Now, if you are on the phone and people enter into the clinic, if you're in the reception area and you're on the phone, we always like to greet clients when they come through the door. If you can't, if you're on the phone, then when they enter the clinic, you want to at least wave to them, smile, let them know like, you know, I'm on the phone, but I see you, hi. And then once you're off the phone, you can really greet and welcome them. Usually with receptionists, we'll have like one will take phones for the day, one won't, or try to have a rule of thumb of one being free so that we can at least still greet the clients when they come in. Again, that's that first impression. Even if you're a vet assistant and you're in the front lobby because you're helping with something or discharging a patient, if you notice that the receptionist can't greet a client, turn around and greet them, you know, make them feel welcome and try to help with that. We focused on this a lot in the first half of the module for 103-1, looking at like, what is the human animal bond? And we know this is all about perceptions and changing perceptions on how people think about their pets, how pets think about people, families, clients, medical care, all of these different perceptions and expectations that people have for one another. So this always ties into that bond and into the root of veterinary care. Now, we will be documenting these relationships and bonds within a household, especially through veterinary care, you know, who's the owner, who takes care of them, who does what. This is something that we'll be documenting and keeping a look at through their medical records. Not something that, you know, we're constantly asking about, but we do document those relationships that are seen. Now we will see there's a few different types of bonds, strong bonds versus more weak bonds between that human animal. And this can all tie into decision-making processes, which is also indicative of financial considerations. We can also see that there will be realistic versus unrealistic expectations, and this can change with assistance animals as well. And with those strong versus weak bonds, we're going to see that usually with those stronger bonds, we see benefits with preventative medicine and care, and also better end of life decisions. And, you know, this is all going to tie into who has those bonds, who doesn't. And again, there's going to be certain people within a family that have a stronger bond with the patient than other members in their family. You know, depending, you know, if it's the sister's main dog or the brother's cat or what have you, we'll see that stronger versus weaker. And that can also make it a little bit of a gray area when we're looking at those preventative medicine decisions or end of life decisions where there's multiple people that have a say in the final decision for the patient. So sometimes we have multiple people that have to sign off on consent forms and all of that. There's multiple owners, multiple bonds being made. Okay, we're going to get into kind of what we're going to talk about for the rest of the lecture, which is looking at grief and euthanasia and counseling, and what do we move forward? What do we do in those situations? It's never an easy topic to talk about. And reasonably so, there are feelings that go along with it. You guys, euthanasia is just a normal part of our job. And I don't mean to say that as like, you know, a really strict, tough person. It's just part of it. Get used to it. That's not what I'm saying at all. We see really good things and we see really bad things. We can't all just have happy-go-lucky times in vet med, unfortunately. And one thing to remember, you know, when we're looking at especially grief counseling with our clients, is there's a lot of ups and downs and there's a lot of different stages to grief. So everybody's going to react a little bit differently, and it's okay that they react differently. So there's no linear progression of grief. A lot of up and down feelings, emotions, and stages. And we have to be able to identify that to have appropriate client communication during this time. So getting into what are the different stages of grief, and you guys, people will feel this in any type of grief situation. I'm not just purely talking about euthanasia or loss of a pet. This is what we'll see regardless, pretty much anywhere. So looking at these stages, we have denial. This is going to be the first stage, and this is mostly used as a coping mechanism. The denial is basically thinking like, no, this is not happening to me, kind of a thing. This could never happen to me. This isn't happening to me. They have somebody else. They're, you know, it's not my dog. Denial, denying it completely. Very normal. Bargaining is another one, which is like fighting with a higher power for the life of a pet. If you ever, you know, prayed so hard that, you know, they would make it or something would be better for a miracle, you've been familiar with bargaining. So it kind of can keep that hope alive and buy time for people or for that pet. And people can even try to, you know, make promises by the pet and offering favorites and doing all these things, bargaining, trying to not come to terms with what's actually happening. Then there is a stage of anger. And in vet medicine, this is mostly directed at the veterinarian and other team members, families, friends, themselves, everybody. People can get very, very angry and defensive just as a side effect of grief. There's also guilt. And guilt is, it's an unproductive and debilitating emotion, and it can come at any different time and absolutely squash any type of progress. So it's going to stop any progress from being made, and it can keep somebody in a really vicious cycle of grief. And then at the end of the grieving process, we're going to see sorrow. And this is the core of the grieving process, really that big healing emotion. And this is where the relief and release happen through the stages of grief. So coming to terms with what have happened, and trying to move forward with that, knowing, you know, it's going to be okay, and not holding that guilt anymore, really letting go. Not saying letting go of that patient's life and, you know, like they didn't mean anything, but really just healing from it, release, relief, and healing. And again, any of these stages, they can happen at any time. So somebody could just feel guilty at first or angry at first. And so there's no way to say what stage they're going to go through all at one time. And depending on where they are through the stages will also depend on how we're going to treat our clients too. We can also see resolution, and this is the realization that the pet is gone. I've come to realization my pet is no longer here. They'll remember the good times. They might even want to share good times with you. Clients will do this in times of grieving. During euthanasias, they'll tell you about their favorite times together, and it's really just trying to reminisce in those happy memories. And it can be hard to hear as a veterinary professional. I would be lying if I didn't say that it was. It's really more of it's a quite beautiful thing. You have to realize, you guys, we don't euthanize just because. We euthanize only when that is the best solution for that pet, when that is the best prognosis and form of treatment for that pet. We don't euthanize happy-go-lucky, awesome, you know, pets that can live a long life. We don't just euthanize anything. There has to be a reason. It has to be an end of care, end of life stage decision. So yes, it's sad. This patient is going and crossing over the rainbow bridge, but it's also can be a really happy and reminiscent time for those owners saying, wow, look at that long life that this patient that I got to share with this patient. And I think that's really beautiful. And I've had that own realization with myself and resolution with myself with saying goodbye to some of my animals as well. Very sad situation, but wow, how blessed I was to have, 14 years with my dog. So I think that's one of the best stages to catch people in. And loneliness is also a part of grief. And this can be in the company of other people or pets, depending on where that loss is. And some people cope with loneliness in different ways, of course, too. Some people will, sulk in that loneliness, while other people hate that feeling of loneliness and they will turn right around and get a puppy the next week or a new kitten the next week. And there's no right or wrong way to go. I would never judge anybody anyways for their grieving process, but we can definitely see some adverse, decisions from that. Now, after a case of euthanasia where a patient has crossed over that rainbow bridge, replacement can be something that can happen. And I don't mean to we're replacing this old, coming in with the old, out with the new, because it's never going to be that way. The new pet can never become the old pet by replacement. It will never be the same, regardless if it's the same breed, the same breeder, the same sex. It doesn't matter. That new pet will never fill the shoes of the old one. However, it's the client's decision. If they want to get a new pet the next day after their patient was euthanized, that is their decision. And that's all part about how their coping process is. Some people never get another pet. It's just like they can't bear with the pain anymore, or it takes them years to finally get another pet. Some people never want to bond with another pet again. They had such a strong bond with that one animal that it just is heartbreaking. They don't want to bond with another pet. Most people do. Some people, it takes them years to get another pet in their life. Some people, a matter of days. So it really just depends. And we see it a lot with older clients. Elderly clients, they're like, this is my last set of pets. After this one passes away, we're not getting any more. It's like the worst. I hate hearing that, to ever think that I wouldn't look forward to having more animals in my life. But it is something that we do see. And again, we're going to have mixed opinions. I know you guys are probably thinking that's so wrong though, to get a pet the day after. We might think that way, but that doesn't necessarily mean that it is. Everybody's going to be grieving differently, and they cope with their emotions, deal with their emotions differently. And just because it might not be something that I would do doesn't mean that it's wrong for somebody else to do it. Now, part of being a veterinary assistant, we will be assisting with bereaved pet owners. So you guys, we are present in euthanasia as assistants. We assist in euthanasia. We will help with getting the forms signed off. We will get them checked into the room. We'll weigh the patient. We'll help get an IV catheter placed in their front legs so that we can give the euthanasia drugs easily and comfortably with the owners being present. This will depend. To kind of pause for a moment, owners do have the choice of being present or not present. So if they decide to not be present, that is their choice, and we will still go through the euthanasia process like we would if they weren't present. We'll be there to comfort that pet and give them treats and loves, and we might not always place a catheter if they're not present. We don't need to. We can use a butterfly catheter instead. We don't have to place an IV catheter, but so we might run it a little bit differently. And I used to get really upset when people would just drop off their animals for euthanasia. I'm like, who in the world wouldn't want to be by their animal during a time like that? I just couldn't even fathom that. But over years in the field and seeing people's reactions, this and that, again, we can't judge them for being that way. Some people just literally can't. They cannot be there. That would be something that would be scarred and burned into their brain for the rest of their lives. And they can't even fathom to watch, their own pet pass away. So again, I used to get really upset at first, but you guys, passing on knowledge from one person to another, it's not worth it. know that everybody's going to take it differently, loss differently, and what you can handle is going to be different than what somebody else can handle. So if the client does decide they want to be present, which more than, I'd say like 75% of owners are present. So only a good 25% aren't. For the most part, people are going to want to be there, and they'll bring anybody and everybody. Sometimes we're packing like a whole family, a whole 10, 15 people into an exam room sometimes because, you know, it was a whole family's pet. So we want to try to assess the client's feelings. What stage of grief are they in, and what are they experiencing? We always want to acknowledge their sadness and encourage healthy coping skills. You know, so offer support, offer assurance, try to be understanding and validate their feelings. You know, I understand what you're going through right now is, you know, extremely difficult to have to say goodbye to a best friend, to see them pass over the rainbow bridge, but, you know, we're all here for you and we support you and know that this is the best decision for this pet moving forward. So it can, you know, it's going to feel a little awkward at first, especially when you don't know the clients. It can be harder if you know the clients and you know the patients, you've worked with them for years or seen them recently a lot or what have you. At first, euthanasias were fairly hard for me. You know, I would get really teary-eyed and it was really sad. I was one of those people, and it was so funny. I had Miss Miller with me this morning and we were lecturing together, and she's one that, like, you know, would cry like with owners and get very emotional, like right up front with everybody. And I'm not that way. I would be one where like I would be sad on the inside, but I'd stay like really strong and like tough. And as soon as the day was over, I'd go into my car and just like tears. I would just like let it fall. I would let all the emotions finally come and hit me. So it doesn't make you right or wrong to be either way. You don't have to be crying in that exam room with them, but you also can be, and it's completely okay. So, and again, with your coworkers, don't judge your coworkers. Everyone's going to deal with it differently and process it differently. When you've been in the field for a little bit longer, you will learn coping mechanisms and coping skills for yourself so that you are not so, you know, completely crushed and stopped in your work for that day. Euthanasias can happen at any and all times of the day. So if this happens second appointment of the day, you can't just call out and be like, I'm done for the day, because that was a sad case. You still have, you know, 30 other appointments to treat for the day. So we do have to learn how to deal with it, maybe wrap it up for later to go, you know, cry about it later. That's okay. But we can't just walk out on the rest of our patients for that day. That's really, really important, you guys. It's different if it's your own pet, absolutely different. But for a client, feel those feelings, know that it's going to be okay. You will get better and easier at it. You're not allowed to not work in euthanasia, you guys. It's not an option to say, I don't do euthanasia. That's like saying I only deal with puppies and kittens and nothing that's happy. Like that it doesn't work that way. It is a daily part of our job, and it's okay to feel what you're going to feel. It will get easier. Don't be so hard on yourself. Talk with people about it, and acknowledge your loss. That's important too. So we want to, with our owners, we want to acknowledge their loss and validate them. Really, really important. We're going to be reflecting and summarizing that client's expressions of grief. We want to convey our understanding towards the situation and really open it up for any open communication if they want to talk. We don't have to be there. Usually once we euthanize the pet, we give the injection and the pet has crossed over, we will exit the room and let them grieve over their patient for however long that they need. But while we're getting the paperwork signed, we're getting them checked in, we're doing all of that, there will be small talk, and sometimes they do express those expressions to you, tell you stories, and have that open communication. We do want to validate their loss, again, understanding that client-pet relationship, that human-animal bond. And some people, you know, they will be looking at the replacements a different way. You know, can they replace this pet? Maybe that was their sole companion. Maybe that was their protector, their best friend. So it's really important knowing that I know that you guys all know this. You guys all have passion and love for animals, which is why you're here. But for some owners, these pets are their children. It's like losing a child, or that's their sole companion. They lost their husband or wife, and now they just have their dog or their cat. That's their best friend, whatever have you. So animal loss can be just as hard as losing human, if not harder, depending on the situation. So just also knowing that too. Sometimes these people, that's all that they have is their pets, and it can be a really, really hard emotional loss. I've had clients that stay in the hospital for 3-4 hours crying over their lost pet after euthanasia, like hours after, because that was their fur baby. We call them fur babies for a reason. They didn't have children, they had pets, and that's becoming more common nowadays. Especially with the younger generations not having children, really just having pets instead. It's becoming very common. So continuing on with acknowledging the loss, what we can do for support, of course, being attending to people, showing them through body language, and being mentally and physically present there for the client. If you know the client, you've worked with them for a few years, or you know them, patient was hospitalized, you saw them every day, you've built up a good rapport and a relationship with the owner, you can give them a hug, you guys. It's not like owners are off limits and you can't touch them. Obviously if it's in a consensual action, of course, but I've my arms around owners. I've fully hugged and embraced owners and cried with them when they've lost a patient, because I knew them really well. I knew their cat or their dog really well. And it's just what felt right in the moment and helped with acknowledging and being attentive for that loss. So we're allowed to hug them, be there with them, cry with them, especially if that's, feels right in that situation, them. It is important, of course, to have that effective listening, giving them your complete attention to that client, giving time for silence, crying. They're going to maybe be rambling about stories or about the pet, or they might even begin to show anger. So biggest thing is showing empathy and understanding for these clients, never retaliating back. They might start to get angry and get mad at us or the doctors, and that's okay. Again, that's a stage of grieving, and we just have to take it as it is. Don't take it anything more than just a face value. People don't really mean what they say when they're grieving and when they're really upset. So just know they just lost their baby and they're going to need some time. They probably will feel really, really bad about it. But not at that time. They're going through one of those, anger stages. Now, achieving closure is going to be something that we shoot for, of course, to give that client the directive. So this could be memorials, scrapbooking, support groups for those owners. And there's many of things like that out there, support groups for people. And we do in the clinics, we'll offer for cremation. So we can take the ashes or take the pet's remains, send them off to be cremated. And then we can return the ashes back to the owners in an urn, and they can actually make a memorial out of it. Owners do things like scrapbooking and memory boards and such too. Now, we talk a lot about the effects with the clients and the patients with their bonds, but again, there's also effects on the staff. There's going to be personal beliefs and feelings that come into play. You will emphasize and care, but with an emotional distance for people and their pets. Again, it's not happening to you necessarily firsthand, but you're still going to feel that loss and that grief. So tips moving forward for that with handling grief among staff members in the veterinary field is using like a team approach to it, and having the staff have that support group for one another, being there, open communication. Again, we can refer clients to a pet loss support group. That's something that those are common. They're everywhere really. And encouraging that big open communication with everybody. Okay. Summarizing up with compounded loss. So the loss of the pet will bring up memories of other losses for people, can be human or animal. Sometimes when a client loses their pet, they can then start talking about, when they lost their husband or their brother or their child. It can happen. grief can trigger other grief and memories, and that can come into play as well. So we do want to invite the client to talk about these other losses. We don't just want to skim over it or not care. We do want to invite them to say whatever they want to say. Again, that open communication. We have to be there for them in that situation. And acknowledging those signals that they're going to be giving us, we want to recognize and respond to any deep despair that we might be seeing in our clients. And this can be verbal or nonverbal signs. We want to help them if we can by contacting a reliable friend or relative, or just letting family members know, this person looks like they're really experiencing deep despair. If we're really concerned, if we know the owner lives by themselves, they're a widow, and they don't have any other family, we might actually even call the police to have a welfare check on that person the next day. It is something common that we'll do. We want to make sure that our clients are okay, especially after experiencing severe loss. We do have crisis intervention hotlines, and we can give information and brochures to owners as well. That's part of kind of informational stuff that we can give them post euthanasia. We can even give them referrals to mental health specialists. And if it's a really, really severe situation, we can have police escorted to a psychiatric facility for the owners. Now, I have had to do a welfare check on owners before and give out literature to them because of loss and all of that. So it is something that we do see from time to time. Again, especially if they have no one else, like their pet is their baby and that's it. So something that we do have to be aware of as well. Some people don't have family or other people that they can go to about their loss, and their animals were, are their lives. So last little picture slide I want to show you about euthanasia. These are paw print impressions. So we will do these when the patient crosses over the rainbow bridge. We will take their paws and we'll usually trim their toenails, especially if they're long, because we don't want them poking totally through the clay. And we'll make a mold. We can press it into like a heart or a round mold, or there's a few other molds that we can do. And then we'll press their paw into the clay to make an impression. We can add jewels and cute little, kind of ceramic little jewels over here to decorate it. We can draw their name or do little impressions of letters to have their name on there, or a little message. And then we bake the clay in an oven, and then it becomes like rock solid. So these are what we give to people usually as like a keepsake from their pet. We can even cut off hair and put it in like a shadow box for them. Those are kind of common keepsakes from euthanasia, and we don't charge for these. They should be included within the euthanasia costs. Okay. All right, guys, we're going to get into the last portion of our lecture here. So don't worry, we're just going to power through. I just have this slide, and then I want to show you some forms, and then we'll be finished. So common forms that we use in the veterinary practice. We have client and patient information sheets, patient history forms. So information sheets are like, who are you, where do you live, phone number, email. For the client, for the patient, it's like what breed, how old, medical history, all of that. And then we can also get their actual scanned patient history from different hospitals. If they are going under any anesthesia for a surgical procedure, they do have to fill out a consent form, and that involves informed consent as well. When we do euthanasias, they have to sign off on the euthanasia release form before we perform the euthanasia. Rabies certificate, whenever they get the rabies vaccine, they'll get their tag and their certificate, and those health certificates as well. They will get them issued to them if they are traveling. So let's take a look at these forms here. So here we have this is like a patient information form. So we have client up top here, and then patient down below. So kind of mailing address, phone number, driver's license, all of that. And then the animal's name, species, birth, breed, color, all of that. This is also like another information sheet for the clients, and kind of a different form, because we could just be asking them if we want like cards on file, how did they hear about them? So these are just different questions, different forms that we can see it written as. This is a surgery and anesthesia and treatment consent form. So when we're doing procedures on them, we will read through this form with them. Word by word, we're going to read through it with them and then help them make the best decision for their pets. So whether they accept or decline certain things for that procedure for the day. This is a euthanasia release. So they would be, giving off the release that we know that this is what we're doing today, the date and the sign of the owner, again, before we go forward with that process. And this is an example of a rabies vaccination certificate. So we can see, we'll have the owner's information, the pet's information here, the date that they were vaccinated, when it's due again, how long it's good for, the veterinarian, the license number, and the veterinarian actually signs off on this as well. They'll sign right here. All right, and that's going to be the end for today's lecture. And again, that's the end for chapter 2. Sorry guys, I'm trying to end that recording here real quick.